Hello, my name is Dr. Jesse Chrastil, and welcome to the journey to improve your quality of life through a minimally invasive knee replacement surgery. Thank you for taking the time to watch this video. Hopefully this video helps explain what a knee replacement surgery is, some of the risks and benefits associated with knee replacement surgery, and then some of the recovery aspect as well. Hopefully I can help along the way and throughout the journey of knee replacement so we can have a successful outcome together.
So what is a knee replacement? The term knee replacement is actually a little bit of a misnomer. The term knee replacement suggests that the surgeon is taking a large piece of bone off the bottom of the femur bone, a large piece of bone off the top of the shin bone, and then basically putting a large mechanical, almost hinged construct in between to make a new knee joint. That's just not quite true. It should be known more like a knee resurfacing procedure. The reason is we're only removing bad articular bone or arthritic bone off of the bottom of the femur bone and off the top of the shin bone. So what we do is we shave about a quarter inch of bone off the front, the bottom, and the back of the femur, a quarter inch of bone off of the top of the tibia or shin bone, and a quarter inch of bone off the back of the patella. You place a metal cap on the femur, you place a metal cap on the tibia or shin bone, and a little plastic button on the back of the patella. Basically what we're doing is removing the arthritic bone and resurfacing the articular aspects of the knee. So what are some of the risks and benefits of a knee replacement surgery? The biggest risk, the one I worry about the most, is risk of infection. The risk of infection is relatively rare. It's about 1% to 2% depending on the population. In the state of Colorado, we're closer to the 1% because on average we have a healthier population. We do everything in our power to minimize those risks during surgery and after surgery, but again, unfortunately, that risk is not zero. There's risk of some post-operative stiffness. Physical therapy is incredibly important to minimize that risk. We're going to get you into physical therapy right away and try to get that knee moving right away to minimize risks of stiffness and scar tissue formation. There's risk of blood clots. That risk is relatively low. It's about 1% to 2%, but we actually have an entire team dedicated to do risk stratification of you, the patient, to make sure we are minimizing those risks based on your risk profile. There's some risk of fracture or loosening of the components. Those risks are very, very low. There is risk of continued pain even after surgery or the need for more surgeries. Again, we do everything in our power to minimize these risks, but unfortunately, it's still not quite zero. So let's talk a little bit about the day of surgery. So the day of surgery, you'll come into either the hospital or the surgery center. You'll chat with me in the preoperative holding area. You'll chat with your anesthesiologist. The anesthesiologist will take you back to the operative suite. We usually do a spinal anesthetic, so they'll give you a shot in the back. You're numb from the belly button south, and then they give you a gentle anesthetic to help make you sleep, snooze throughout the rest of the surgery, okay? It's a pretty gentle anesthetic, kind of like colonoscopy medicine, much more gentle than a full general anesthetic. So when you wake up, you feel somewhat rested rather than hungover for like 3 days. Surgery itself takes about an hour. We have you up and walking the same day. We actually have you doing stairs the same day. You'll be using a walker for about the first week to 2 weeks. And I tell this to everybody, for the first week to 2 weeks, you don't like me very much for the first week to 2 weeks. It's pretty sore, it's pretty stiff. You're kind of like, why did I do this? But then you start noticing the light at the end of the tunnel. Things start getting better and better the further out you get. It does, however, take about 6 weeks before you are as functional and independent as you are today. Now, today you're not perfect. That's why you're here seeing me and my team. It takes about 6 weeks just to get back to what your current baseline is. And that's when you start seeing the light switch turn and things start getting better. You start improving. You start doing some of those things that you wish you could do now, but you can't, like go up and down stairs painlessly and things along those lines. You'll be doing physical therapy for the first 6 weeks. Physical therapy is incredibly important in a successful outcome in knee replacement surgery. The physical therapists have plans and protocols in place, and as long as you follow their protocols, I think we're on our way to a successful outcome. Thank you very much for taking the time to watch this video. We will give you a link to this video, as well as we'll give you a handout and a PDF available format of the booklet so that you can review this information with your friends, family, and make a decision on how and when to proceed with your knee replacement surgery.